We're talking to Dr. Ralph Benson, urologist, and the topic is prostate problems and new treatment. And of course, Dr. Benson, before we had our first commercial break, we were talking about some of the problems generally associated with the old treatment. And let's allow you to continue that discussion before you get into the new treatment.
Surely. With trimming out the prostate, the patient's clearly in the hospital for a couple of days. He has to have anesthesia. So all of this is reasonably expensive. It's probably the best part of $7,000. On top of that, many folks can't go back to work because of the possibility of inducing bleeding. Any physical activity, anything lifting over 10 pounds, you really can't do. And in addition to that, there's about an 18% morbidity issue here in terms of adverse things that we don't want. 10% of patients with impotence, a small number of patients having incontinence or difficulty holding their urine after we remove the prostate. Things such as that, the infections, can be a problem. So we've looked at ways of trying to improve upon this. And there are a couple of avenues that have been approached. One is we'd all love to take a pill and have it go away. Well, fortunately, there are some medications that are available today, and there are really two classes of medication. One class, which is a long name, it's a 5-alpha reductase inhibitor class of drugs. What that does is basically not let the cells in the prostate use male hormone to grow. So the prostate actually shrinks a bit. The use of this drug has been a little bit disappointing because it may not be quite as specific as we would like. But I know there are many companies that are working on improvements. So that's one class of drugs. The other class of drugs are things called alpha blockers. The prostate is composed of glandular components, fibrotic components, and also a lot of smooth muscle. And the alpha blockers actually act on the smooth muscle to relax the smooth muscle. So we're relaxing the tone and opening up the prostate. These have been popular. There are 3 or 4 different companies that make products that are useful. But the problem with medications are that you have to take them forever. And if this starts in your 50s, that goes on hopefully for a long time and can be reasonably expensive, up to about $1,000 a year to do that. And as we all know, I mean, you can't even remember to take your vitamins in the morning, let alone something else. So this can be an issue. But the pills are there. An alternative that we would like to see would be minimally invasive procedures that can get this done in a single instant, if you will. A little like going to the dentist and getting your root canal. Have it over with and not have to think about taking the pill. And if we look at these new technologies, we have to look at them in terms of, do they work as well as the gold standard, the trimming out? Does it last? Is it durable? Importantly, are there fewer side effects? And very importantly today, as we all know, with the dollars involved, can we do it for less money? Now, all of the approaches that have been used for minimally invasive techniques have looked at heat generation in one way or another, trying to kill the cells with heat. Now, one ingenious way of doing this is what's called thermotherapy or microwave therapy. And what's done is a tube, a catheter is placed in here with antennae. And microwaves are passed through this, and it's a little like a microwave oven. What you're doing is you're simply heating the prostate, and those cells will subsequently die, hopefully. The downside of the microwave technology is it's quite expensive. The machine itself, the capital cost is $150,000 to $300,000. That's a good deal of money today. The catheter itself is quite expensive. And unfortunately, the retreatment rate is quite high. So I look at that as a bit of a negative.
In other words, once you do the treatment, it's a possibility you have to do it.
Come back and do it again. And we would certainly like something that's going to last 5 years at least, even if it is cheaper. The second approach has been a laser approach, and this was a great interest of mine. We initially went into the prostate and then shot the laser beam at right angles here and tried to essentially cook the prostate. That worked, but caused a lot of irritative symptoms. The patients had frequency and urgency of urination. It felt like, geez, I've got to go for a long period of time. We then thought maybe we could put the fiber into the prostate basically into the tissue, then turn it on and heat a ball of tissue and have that work. Indeed, that is one of the very popular techniques now. Problem with that technique up until now has been, again, you need to have anesthesia. So we would love something that we could translate into the office and say, Mr. Jones, you come in, we'll give you a little something to take the edge off this like the dentist does. We're going to then do something in your prostate that's going to shrink it back. And this has been our interest of late with the procedure called transurethral needle ablation of the prostate, abbreviated tuna, like tuna fish. And what this amounts to is radio frequency waves that are placed through a probe. We go up into the prostate. We can place little needles then in the prostate, and we can do this with just local anesthetic in the office. Around the radio frequency waves pass through these needles, and around this is a ball of cells that die because of the heat. And we will make 2 or 3 sticks, if you will, on either side of the prostate. The patient can often leave the office without a catheter and go back to his normal activities a day or so later. Now, we're actively involved with looking at this now because we truly believe that this will save patients time, it will save money because it's not done in the hospital with an anesthetic. Its efficacy appears to be very good. There have been over 10,000 patients treated in the world now, and there are data from as far away as South Africa, actually, giving 4-year data that are durable. The patients' flow rates increase, they're not getting up as often at night, and they're emptying their bladders. So when we look at this, and when we look at actually the cost, it's done for probably 1/3 of what trimming out the prostate would do. I do think that we need to get over, men have certain proclivities, and one of them is they don't want anything done below the waist, and but I think that what we need to do is to try to get the message out that this honestly isn't painful. We have now done, I think, 35 patients in a row in the office, and very honestly, nobody has said, oh, stop doing that, you know, I can't handle the discomfort. So, and realistically, I don't think it's any worse than going to the dentist.
And so, and of course, Doctor, we've got about 20 seconds before our second commercial break, and when we come back, we want to talk about how that compares perhaps to what you consider the gold standard, and then to talk about some of the other problems associated with this disease from a national health point of view. Of course, we'll be back with you following our second commercial break.